Hi guys, and welcome to sqadia.com. Today the topic that we'll be talking about is oral candidiasis. Now, what is oral candidiasis? It is basically an infection which is caused by a yeast-like fungal organism which is known as the Candida Albican. It is the most common oral fungal infection which is present in humans. Around 30 to 50% of the people are just carrying it in their mouth, and it is a part of the normal oral flora. Now, the Candida albicans exists in two forms, and this trait is known as dimorphism. The yeast form is innocuous, meaning it is harmless, just like a ladybird. Whereas the hyphal form, it is associated with the invasion of the host tissue. It is harmful, just like a bee. Now, there are three general factors which determine the infection. The first is the immune status of the host. Now, let's look at it in more detail, that what are the further factors which may impair the immune system. First of all, there is cigarette smoking. Then there is malnutrition, like iron deficiency, vitamin B12, or folic deficiency. Diabetes. Also, the immune system may be impaired. There may be defective cell-mediated immunity or HIV. In some cases, broad-spectrum antibiotics may cause the suppression of the normal oral flora, which will cause the Candida albican in the mouth to become more virulent. Also, poor oral hygiene or poor hygiene of the denture. This is also a contributing factor. In cases where there is hypofunction of the salivary glands, there is going to be reduced salivary production, which is going to cause the oral mucosa to be more prone to the Candida. The oral mucosal environment, how clean it is, and finally on how virulent the strain of the Candida albican is. Now let's look at the classification. It is basically divided into the acute and the chronic form of the Candida albican infection. Now, the acute involves pseudomembranous candidiasis, also known as thrush, or erythematous candidiasis. Whereas the chronic can be further divided into the atrophic kind and the hyperplastic kind. The atrophic may be angular stomatitis or the denture stomatitis, whereas the hyperplastic involves the candida leukoplakia, the median rhomboid glossitis, and the chronic mucocutaneous candidiasis. Now let's look at the pseudomembranous candidiasis, also known as thrush, in more detail. Basically, it is the presence of adherent white plaque which resembles cottage cheese or curdled milk on the oral mucosa. These white plaque are composed of tangled masses of hyphae, yeast, desquamated epithelial cells, and debris. The main causes of the pseudomembranous candidiasis is the broad-spectrum antibiotic. This eliminates the competing bacteria. Also, the impairment of the patient's immune system. This is also one of the causes. Now, that may include leukemia or human immunodeficiency virus, the HIV virus. Another cause may be infants. They may also be affected. This occurs due to their immature immune systems. Now, did you know that the antibiotic exposure, usually this is acute and quick or fast expression of the condition, whereas in immunological problems, this usually produces a chronic form of the pseudomembranous candidiasis, which is usually slow in onset and it is long-standing. So, we will be able to differentiate the cause on the basis of the symptoms and the presentation of the disease. Now let's look at some of the clinical features of the thrush. It is soft and friable. It is also creamy in color, which appears as plaques on the oral mucosa. It basically varies from isolated small flakes to widespread merged plaques. It may be present on the buccal mucosa, the palate, and the dorsal surface of the tongue. Now, a burning sensation may be felt by the patient and an unpleasant taste in the mouth. A very distinctive feature of the thrush is that it can easily be wiped off. And when we wipe it off, the underlying mucosa is red, erythematous. Now, the histopathology. Now, the histopathology that we are going to discuss over here is the generalized histopathology for all the types of the oral candidiasis. We will discuss more if there is any new presentation for any kind. Now, generally, we are going to see large masses of tangled hyphae, as we can see in this picture. There is also going to be detached epithelial cells and leukocytes. The hyperplastic epithelium is going to be infiltrated by inflammatory cells, predominantly the neutrophils. Over here, we can see a hyperplastic epithelium, which is invaded by the neutrophils and the inflammatory cells. Now, over here, the epithelium is hyperplastic. This happens to protect the underlying mucosa. It is a protective mechanism of the body. Now let's discuss the management. First of all, we need to withdraw the offending antibiotic, which basically caused the suppression of the normal oral flora. Then we're going to prescribe the patient nystatin oral suspension, which is 100,000 units per gram. We're also going to prescribe some amphotericin B lozenges. Now, what is amphotericin B? It basically allows the normal oral flora to return to its normal state. Both of these are to be taken 4 times a day, QDS, for around 10 to 14 days. And we also need to advise the patient to practice appropriate and good oral hygiene practices. Now, let's move on and talk about the erythematous candidiasis, also known as the acute atrophic candidiasis or the antibiotic sore mouth. So the name tells us its cause. This term basically applies to patchy red mucosa or patchy red macules on the mucosa. And a very important thing over here is that it is more common as compared to thrush. So what are the main causes? Again, the broad spectrum antibiotic therapy. Xerostomia, it can occur due to any reason like pharmacological interventions, post-radiation therapy, or just a Sjogren syndrome. So what happens in xerostomia? Basically, the salivary gland is going to hypofunction, so less saliva is going to be produced. Now, this causes the alteration in the normal oral flora, and that eventually leads to the increased risk of the oral candidiasis. Now let's discuss some of the clinical features. There is going to be burning sensation. The patient often complains that the mouth feels as if a hot beverage has scalded it. Now, the burning sensation. This occurs due to the loss of the filiform papillae of the tongue on the dorsal surface of the tongue. And this results in a reddened, bald appearance of the tongue, as we can see in this picture. It may also present as asymptomatic, but it may be chronic. This type is known as the central papillary atrophy of the tongue, also known as the median rhomboid glossitis. See, the names of these diseases are going to help us remember the kind. So, median basically means that it is located in the center, and it is a well-demarcated erythematous zone. Now, this erythematous zone is due to the loss of the filiform papillae in the area. Now, the lesion is also symmetrical, and the surface may range from smooth to lobulated. Now, some patients with central papillary atrophy may also exhibit signs of oral mucosal infection, Candida infection at other sites as well. And if that is the case, then this is known as the chronic multifocal candidiasis. Basically, the junction of the hard and the soft palate and the angles of the mouth are involved. And the palatal lesion, it appears as an erythematous area, a red area, on the part where the tongue rests on the soft palate. So this gives it the name of a kissing lesion. Now let's talk about the management. It is the same as the management for the thrush. So what we need to do is withdraw the offending antibiotics, use nystatin oral suspension, amphotericin B lozenges, and practice good oral hygiene. Now let's move on and talk about the angular stomatitis. This is typically caused by the leakage of Candida infected saliva at the angles of the mouth, and it is also seen to be associated with denture stomatitis. This occurs due to reduced vertical dimension of the denture. This is basically the distance which is measured between two points of the occluding members when they are in contact. What happens here is that the saliva tends to pool in these areas, which harbors the Candida Albican, keeping the area moist and thus favoring the yeast infection. Some of the clinical features include Candida infection being more extensively involving the perioral skin area, meaning the skin around the mouth. It is also secondary to the action of the skin being moist around the mouth, so actions like chronic lip licking or thumb sucking. This creates a clinical pattern which is known as Candidiasis. Chylo means lip, so candidiasis around the mouth. Mild inflammation is seen at the angles of the mouth, as we can see here. Now, this inflammation frequently extends to involve the folds of the facial skin, which is extending from the mouth. Now, as we all know that the folds of the facial skin become more prominent with age when there is sagging of the facial tissues. Now, let's talk about the management. First of all, we need to eliminate the root cause. Now, this will be done by first of all establishment of the correct vertical dimension, and we can do that by increasing the thickness of the labial phalanges of the upper denture that can slightly lessen these furrows. Secondly, we're going to prescribe the patient nystatin oral drops, 100,000 units per gram. And this is going to be QDS 4 times a day for around 10 to 14 days. And additional to that, we're going to advise amphotericin B lozenges. Again, this is going to allow the microflora to return to normal. This is also going to be advised 4 times a day for around 10 to 14 days. Fusidic acid cream is also going to be advised additionally in case of superimposed infection with Staphylococcus aureus. There is going to be pooling up of the saliva and the Candida, and that can lead to the break of the skin barrier and eventually lead to superimposed infection by the Staphylococcus aureus. So guys, this was it for now. We will talk about rest of the infections in my next video. Thank you.